Hi friends, once again welcome you all back to our channel, the Nurse channel. So hope you all are preparing very well for the upcoming AIIMS NORCET and the JIPMER examinations. So today also we have a set of series of questions, 15 important questions that can be expected in the upcoming examination. So this 30-minute video what you are going to watch today will definitely help you and will definitely provide you minimum some 40 to 50 points, okay, 40 to 50 very important points from 15 questions. Okay, so once again I request everyone who are watching this video to watch the video till the end, because the explanations for each question is also very important. So as you all know, we are including picture based questions and some important dates and some peculiarities of urine and sputum and its characteristics in some diseases. Okay, so definitely this video will help you for a better preparation for the upcoming exams. So straight away, without losing time, we will move on to the questions. And before that, whoever didn't subscribe our channel yet, kindly subscribe and support us. So straight away we'll move on to the questions.
So straight away we will move on to the first question in this series. So the first question for you is from the central nervous system. We will start with a very important question, and the question is here, and the question is, which among the following cranial nerves help in mastication? So the question is, which among the following cranial nerves help in mastication? Okay, so mastication is the key point in this question, and the options for you are option number A, glossopharyngeal nerve, option number B, fascial nerve, option number C, trigeminal nerve, and option number D, abducens. So which nerve helps in mastication? So what is the answer? So there is a chance for confusion and making the answer for this question wrong. So that we will explain the explanation of this question. So first of all, we will see the answer for this question. So the answer is option number C, that is trigeminal. Trigeminal helps in mastication. So we know that trigeminal nerve is otherwise known as the dentist nerve, or it is the largest nerve, cranial nerve. Okay, it is the largest cranial nerve. So which is the longest one? Longest is the vagus. Okay, so the largest trigeminal nerve is the trigeminal nerve, and it is otherwise known as the dentist nerve, and we know that it has three branches. Tri means three branches are there. The first one is the ophthalmic branch, which is a sensory branch. The second one is the maxillary branch, that is also a sensory branch, and the third one is the mandibular branch, and that is a mixed branch. That means its motor and sensory function is there, and the function is mastication, that is chewing. Okay, so I think you got a small information regarding the trigeminal nerve. So we will see the other options also. Another option was the glossopharyngeal nerve. So you will be confused with the glossopharyngeal nerve whether mastication is a function or not, but swallowing is the function of the motor function of the glossopharyngeal nerve. Okay, so the sensory function is the taste, that is it is supplied in the posterior 1/3 of the tongue, and motor function is swallowing, not mastication. Okay, swallowing by the glossopharyngeal nerve. So don't be confused. And another option was regarding the fascial. So you know that fascial also is a mixed nerve, and it has a sensory function and motor function. So sensory function is the taste, that is anterior 2/3 of the tongue. So from here you are getting information, answer for some another question, like the anterior 2/3 of the tongue is supplied by fascial nerve, but the posterior 1/3 is supplied by the glossopharyngeal nerve. Okay, so both function is taste, and motor function of the facial nerve is facial expressions. Okay, so another option was the abducens. Okay, so abducens, you know that it helps in the lateral movement of the eye, and it supplies the lateral rectus muscle. Okay, so from the first question itself you are getting a bunch of information. So straight away we will move on to the second question in our series, and the second question is a picture based question, and the task for you is to identify the bandaging technique. Okay, so this will come in the fundamentals of nursing first aid. So what type of bandage technique is used in this patient's leg? So the options for you are option number A, simple spiral, option number B, reverse spiral, option number C, figure of 8, and option number D, spica bandage technique. So what is the answer? Which bandage technique is used in this patient's leg? So what is the answer? Very important question, and you can expect questions from these areas. So the answer for this question is option number B, that is a reverse spinal. This is a reverse spiral bandage technique. So we will see the other the four bandage techniques. The four bandage techniques what I have given in the options in little detail. So first one is the simple spiral. Okay, so this is a picture of the simple spiral, and it is used for the parts which are of uniform thickness, such as a finger or a wrist. Okay, so this is simple spiral. Okay, it's very just spiral turns will be there. Okay, that's all. Then what is a reverse spiral? So reverse spiral was the answer for the question I have asked. So it is used for the parts which vary in thickness and upon which the bandage of circular turns cannot be tied properly. Okay, so the simple spiral cannot be tied properly with these parts, means the thickness of the part will vary. Okay, so in that areas we are using this reverse spiral technique, and the technique you can refer later. How we have to put the bandage, that you can refer later. So just for your information I am passing this message. Okay, and another option was the figure of 8. So you can see the picture of figure of 8 and how to keep the figure of 8, so that you can refer later. So it is used for the bandaging limb and for covering the joints. Okay, especially for the joints, you can see in the picture, for the joints we are using this figure of 8, and it consists of series of loops encircling the part in the form of a figure of 8. Okay, in the form of figure of 8. Okay, there will be a figure of 8 form will happen in the affected area, especially in the joints. Okay, so that is figure of 8. And another option was the spica bandaging. Okay, so this is a example for the hip spicas. So spica, it is a form of figure of 8. Okay, this is also a form of figure of 8 bandaging, in which the turn is very much large than the other. Okay, so the turn will be very much larger than the other, and it is used for the joints at right angles to the body. Example, the shoulder, groin, thumb, etc. Okay, so that is a spica bandaging. Okay, so this is a picture of spica bandaging. So from any of these areas you can expect question, even picture based or direct questions. Okay, so I think the second question also was useful for you. Now we will move on to the third question in our series. The third question is from the heart anatomy, and the question is, S2 heart sound is best auscultated at which point? So the question is, S2 heart sound is best auscultated at which point? And the options for you are option number A, aortic area, option number B, Erb's point, option number C, pulmonic point, and option number D, mitral point. So in which area, in which part we can heard S2 heart sound very well? So that is the question. So just to remember about the 5 points of auscultation, and you can answer this question very easily. So what is the answer? So the answer for this question is option number B, that is Erb's point. Okay, Erb's point. So we will see where is the Erb's point. So the Erb's point refers to the third intercostal space on the left sternal border, where the S2 heart sound is best auscultated. So we will have a small picture based explanation for this question. So we, as I told in the beginning, we have 5 areas of auscultation in the chest, and the first one is the pulmonic area. It is in the second intercostal space, left second intercostal space, then Erb's point, which is in the third intercostal space, then tricuspid area, which is the fourth or fifth intercostal space, and the mitral or the apex area, which is in the apex of the heart, which is in the fifth intercostal space, and the aortic area, which is in the right second intercostal space. Okay, so these are the 5 auscultation points in our chest, and each point is very, very important. So you should understand about these 5 points. And our question was regarding the Erb's point, that is in the third intercostal space. Okay, left side. Okay, so I think with that we are finishing the third question in the series. Now we will move on to the fourth question in our series, and the question is, the primary treatment modality in polycythemia vera is dash. So the question is regarding polycythemia vera. So what is the primary treatment modality in polycythemia vera? So the options for you are option number A, blood transfusion, option number B, phlebotomy, option number C, iron-rich foods, and option number D, all the above options. So what is the primary treatment in polycythemia vera? So think about what is polycythemia vera and what happens in polycythemia vera. Then you can answer this question very easily. So what is the answer? So the answer for this question is option number B, that is phlebotomy. Okay, so we know that what is happening in polycythemia vera. It is an uncommon myeloproliferative neoplasm in which the bone marrow makes too many red blood cells. Okay, so in polycythemia vera the RBC count will be very high. Okay, so the primary treatment consists of phlebotomy. That means that therapeutic phlebotomy. Okay, so venipuncture will be done and a particular amount of volume of blood will be removed from the body so that the RBC levels will be maintained normal. Okay, so periodically they have to do this. Okay, so this is polycythemia vera. So the other information regarding polycythemia vera you can refer later. Okay, because this is very important. Okay, so phlebotomy is the primary treatment modality for polycythemia vera, and the reason already we have explained. So we will see the answer for the question. So the answer for this question is option number C, that is egg. So egg is low in purine. The other things like meat, fish, alcoholic beverages, they are high in purine and should be avoided in patients with gout. Okay, so we will have a small explanation. Egg are a good protein source for the people with gout because eggs are naturally low in purines. And another one more information, this liver converts this purine to uric acid. Okay, so why you should understand why purine rich foods are contraindicated in patients with gout, because of gout, you know, there will be marked increase in the uric acid levels will be there. So if you are taking the purine high foods, what will happen is this liver converts this purine into uric acid, and that can worsen the symptoms of gout. Okay, so that is the pathophysiology. So that is just an information for you. So the answer for the question is egg. Okay, so now we will move on to the sixth question in our series, and the question is very simple, very direct question. DEXA scan is typically used to diagnose dash. So investigation related question, DEXA scan is typically used to diagnose dash. So the options are option number A, uterine issues, option number B, osteoporosis, option number C, visceral organ issues, and option number D, brain issues. So DEXA scan is used for diagnose what? So DEXA. So what is the answer? So the answer is option number B, that is osteoporosis. Okay, osteoporosis is the answer. So we will have a small note regarding the DEXA scan. So what is DEXA? DEXA means dual energy X-ray absorptiometry. Okay, so that is a full form of DEXA, that is dual energy X-ray absorptiometry, or DEXA is a means of measuring bone mineral density, that is BMD, using spectral imaging. Okay, so that is DEXA, and the DEXA scan, it is typically used to diagnose osteoporosis. Okay, so it usually measures the bone mineral density. Okay, so that's all regarding that question. I think that also is useful for you. Now we will move on to the next question in our series, that is the seventh question, and this is also very important question, and the question is, Currant-jelly or dark red sputum suggests which among the following? Okay, so the question is, Currant-jelly or dark red sputum suggests which among the following? Okay, this is regarding the pneumonia, so you have to identify in which pneumonia you can expect Currant-jelly or dark red sputum. So the options are, first option is atypical pneumonia, option number B, Klebsiella pneumonia, option number C, pneumococcal pneumonia, and option number D, aspiration pneumonia. So in which pneumonia you can expect Currant-jelly or dark red sputum? So the answer for this question is, what is the answer? So the answer is option number B, that is Klebsiella pneumonia. Okay, so you should understand, for exam point of view, you should understand what all characteristics we can see in the sputum in some forms of pneumonias. Okay, so that will be helpful for your exam. So at that point I will explain to you. The first one is atypical pneumonia. You can see scanty watery sputum. Okay, so in atypical pneumonia, the characteristics of sputum is scanty watery sputum. Then another is the pneumococcal pneumonia. In pneumococcal pneumonia you can see a rusty sputum. Okay, and Currant-jelly or dark red sputum can be seen in Klebsiella pneumonia. That was the question what I have asked. And next one is this foul smelling sputum we will be getting in anaerobic infections due to aspiration, like aspiration pneumonia, lung abscess, and necrotizing pneumonias. Okay, so in these pneumonias we can get foul smelling sputum. Okay, so we are getting very information, very good points regarding the pneumonia and the characteristics of sputum from this question. So I think this is very useful for you. Now we will move on to the next question in our series, and the question is a picture based question, and the task for you is to identify the instrument which I have shown in the screen right now. So you have to identify the instrument. So what instrument is this? Okay, so the options for you are, the first option is cuff pressure monitor, the option number B, barometer, option number C, CVP manometer, and option number D, sphygmomanometer. So what is this instrument called? So what is this instrument? So definitely whoever worked in ICUs and all can answer this question very easily. So the answer is option number A. This is a cuff pressure manometer. So what is a normal cuff pressure and how it can be used, that we will explain in the explanatory session. So we can see the picture of cuff pressure monitor connected to an ET tube. Okay, so the cuff is inflated. So here there is a port will be there here, and that will be connected to the ET tube, that balloon. Okay, and that will with that we can measure the pressure inside the tube, and along with that, if the pressure is low, we can inflate air also. Okay, so the cuff is inflated to seal the airway to deliver mechanical ventilation. And what is a normal cuff pressure? A normal cuff pressure is between 20 and 30 centimeters of water, and it is recommended to provide an adequate seal and reduce the risk of complications. Okay, so there should be adequate seal should be there. If the cuff pressure is more, what will happen? So there will be, if the patient is on tracheostomy or with the endotracheal tube for a longer period of time, there will be chances for the tracheal stenosis. There will be necrosis will happen if the pressure is more, and if the pressure is less, means what will happen? Adequate amount of ventilation won't happen. Okay, so that is why we have to keep adequate cuff pressure, and the normal cuff pressure is between 20 to 30 centimeters of water. That is another question that can be expected in exams. So in the picture itself, we can see that 20 to 30 mark, they have marked as green, dark green. That means that is a normal range. Okay, so this is in the upper ranges. Okay, so just for your information, I have explained this. So this is a cuff pressure manometer, which is very important in ICU care. Okay, so the other options we will see. So this is the barometer, and it is a scientific instrument that is used to measure the air pressure in a certain environment. Okay, so why I have included this is in JIPMER like examination we can expect general knowledge questions also. So this barometer, it is a scientific instrument that is used to measure air pressure in certain environment. And another option was the ICU medical CVP manometer. Okay, that CVP pressure monitor. So this is the picture of the CVP monitor. There will be a transducer will be there, and these connections will be there, and it is designed to provide the clinicians a means for measuring a patient's central venous pressure. Okay, so the normal central venous pressure and all you should be aware. That also is very important, that we can refer. And the final option was sphygmomanometer, otherwise known as our BP, that our regular BP instrument, and it is an instrument for measuring the blood pressure. Okay, so I think that picture based question also was useful for you. Now we will move on to the 9th question in our series, and this is from the renal system, and the question is direct question: second stage in the chronic renal failure is. So the question is second stage in chronic renal failure. So you know that there are some stages for the renal failure, chronic renal failure. So the question is regarding the second stage, and the options are: first one is ESRD, then second option is a reduced renal reserve, option number C renal insufficiency, and option number D diuresis. So which is the second stage in chronic renal failure? That is a question for you. So what is the how many stages are there in the chronic renal failure? Then what are the stages? That definitely you should learn that. So the answer for the question is renal insufficiency. So we will have a small explanation regarding the stages of chronic renal failure. So the first stage otherwise is the reduced renal reserve. Okay, so the stage 1 is a reduced renal reserve, and there will be 75% damage. The damage will be 75%, and in the stage 2 renal failure is the renal insufficiency, and in that the damage will be 75 to 90%, and the final stage, that is the stage 3, is the ESRD, otherwise known as the end stage renal disease, and the damage will be 90 to 100%, and patient will be depending upon dialysis or renal transplant. Okay, so these are the stages of chronic renal failure. And one more option was there, that is the diuresis, that is happening in the acute renal failure. Okay, so acute renal failure, so many courses are there: pre-renal, post-renal, intra-renal, like that courses are there, and some stages are also there. So that you can refer later. So regarding the chronic renal failure, these are the 3 main stages, that is reduced renal reserve, renal insufficiency, and end stage renal disease. Okay, so that I think that also is a very important question. Now we will move on to the 10th question in our series. That is another important, very important question, and the question is: dark brown or cola colored urine can be seen in patients taking which medicine? So the question: very very important question. Dark brown or cola colored urine can be seen in patients taking which medicine? So this is regarding the pharmacology and its side effects. So the options are option number A, rifampicin, option number B, chloroquine, option number C, amitriptyline, option number D, propofol. So among this, which medicine can happen dark brown or cola colored urine? So don't be confused. There are chances that you can make this answer wrong. So don't be confused. Read the question very carefully and answer the question. So the answer for this question is option number B, that is chloroquine. Okay, option number B is the answer. So we will have a small explanation regarding each drugs, okay, and how the urine characteristics will be. Okay, so we know that amitriptyline, indomethacin and propofol, if the patient is taking these medicines, the patient's urine color will be blue or green. Okay, so blue or green color urine can be seen in patients taking amitriptyline, indomethacin or propofol. Then you know very well that chloroquine and primaquine, metronidazole and nitrofurantoin, these drugs can cause dark brown or cola colored urine. That was the question I have asked. Then orange, red or pink color urine can be seen in patients taking rifampicin, sulfasalazine and phenazopyridine. Okay, so these are some information regarding the urine characteristics of patients taking some particular drugs. Okay, so you can expect questions from any of these areas. So all these points are very very important. Okay, so I think that also is clear for you. Now we will move on to the next very important question. Another important question, 11th question. HbA1c of 7.6% to 8.9% indicates dash. So first of all, you have to identify, you have to know what is HbA1c and what is its normal ranges. Okay, so here the question is 7.6 to 8.9% HbA1c indicates what? So the options are option number A, normal, option number B, fair diabetic control, option number C, good diabetic control, and option number D, poor diabetic control. So what this value indicates? So what is HbA1c? What is its normal range? So what is the answer for this question? The answer is option number B, that is fair diabetic control. So what is the HbA1c? So HbA1c, it is measured primarily to determine the 3-month average blood sugar level, and it can be used as a diagnostic test for diabetes mellitus and as an assessment test for glycemic control in people with diabetes. So first of all, HbA1c, that you have to understand, it is used to determine a 3-month average blood sugar level. Okay, so that is another important question that can be asked in the exams. So average 3-month average blood sugar level can be identified, determined with the help of HbA1c, and we should know the normal values. So the normal HbA1c should be between 3.5 to 6%. Okay, so if it is 3.5 to 6%, that is normal, and we can say a good diabetic control if there is 7.5 or lower. Okay, so HbA1c is less than 7.5, then we can tell that it is a good diabetic control, and if it is between 7.6 to 8.9, then we can tell that a fair diabetic control is there. But if the value is more than 9% or higher, then we can tell that there is a poor diabetic control over the last 3 months. Okay, so this is also very important. So keep these points in your mind. You have to by heart these normal values. Okay, so with that question is also getting finished. Now we will move on to the very next question in our series, that is the 12th question, another important question, and the question is the classic triad of Pheochromocytoma include. So the question is the classic triad of Pheochromocytoma. So you should understand what is Pheochromocytoma and where it is happening. Okay, so which area it is happening. So the options are option number A, hypotension, headache and dizziness, option number B, tachycardia, diaphoresis, hypotension, option number C, headache, tachycardia, diaphoresis, and option number D, bradycardia, headache and diaphoresis. So Pheochromocytoma, so this is very important, this triad. So what is the answer? So the answer for this question is option number C, that is headache, tachycardia and diaphoresis. Okay, so there will be tachycardia will be there, then as a result there will be diaphoresis will be there, and there will be headache also will be there. So we will have a small explanation regarding this question. So Pheochromocytoma, otherwise known as the PHEO or PCC, it is a rare tumor of the adrenal medulla. So this is another information for you. So adrenal medulla tumor is called a Pheochromocytoma, and it is composed of chromatin cells, also known as the pheochromocytes. Okay, so it is composed of chromatin cells and it's otherwise also known as the pheochromocytes. Okay, so what is happening in pheochromocytoma is the classical triad includes there will be headache. Okay, that is related to the elevated blood pressure. So there will be hypertension will be there. Okay, so headache, that is secondary to the elevated blood pressure. Then tachycardia will be there, that is a high heart rate, and diaphoresis will be there, that is excessive sweating, especially during night, also known as hyperhidrosis. Okay, so the night sweating or diaphoresis, otherwise known as a hyperhidrosis, is a characteristic of which disease? Pheochromocytoma. Okay, so that is also another important point. So you are getting information regarding pheochromocytoma is a tumor of the adrenal medulla, and the classical triad includes headache, that is secondary to the high blood pressure, then tachycardia, diaphoresis, that is hyperhidrosis, that is sweating, excessive sweating during the night time. Okay, so I think that question also was useful for you. Now we will move on to the next question in our series, that is the 13th question. This is regarding a position, and the question is, the park bench position is a modification of which position? Okay, so question is, the park bench position is a modification of which position? So the options for you are option number A, supine position, option number B, lateral position, option number C, prone position, and option number D, Fowler's position. So another important question. So what is the answer? Park bench position. So the answer for this question is option number B, lateral position. Okay, so we will have a picture based explanation regarding this question. So this is the park bench position. Okay, this is the park bench position. So this is a graphical representation. So the park bench position, it is a modification of lateral position, and it provides the surgeon with better access to the posterior fossa. Okay, better access to the posterior fossa as compared to the lateral position. Okay, so in the lateral position it will be difficult to access to the posterior fossa. So this position will help the surgeon for a better access to the posterior fossa. And in this position, the dependent shoulder and the arm, so the dependent shoulder and the arm are positioned outside the operating table, and the arm is supported by a sling. Okay, so here the dependent arm is supported by a sling, and it is positioned outside the operating table. Okay, so this is the park bench position, and this park bench position is used for accessing which area of the cranium? That is the posterior fossa area. Okay, so that also I think it is it's a very important question. Now we will move on to the second last question, and it is a picture based question, and your task is to identify the logo. Okay, so I have shown a logo in this screen right now, so you have to identify this logo. So the options for you are, first option is AIIMS logo, second option is as an emblem of UNICEF, so the third option is Down syndrome logo, and the final option is emblem of WHO. So what is the answer? Identify the logo. Again, slightly confusing, but you can answer it correctly. So the option number C, it is a logo of Down syndrome. Okay, Down syndrome logo. Don't confuse it with the AIIMS logo. AIIMS logo is red in color, that we will see. So this is the Down syndrome logo, and the World Down Syndrome Day is celebrating on usually celebrates on March 21st. Okay, World Down Syndrome Day is on March 21st. That's another important information for you. And the another logos, that is this is the AIIMS logo, and the World AIDS Day is celebrating on which day? 1st December. Okay, so 1st December is considered to be as the World AIDS Day, and this is the AIIMS logo, that is red in color. Don't be confused. Then another option was the UNICEF. So what is the full form of UNICEF? United Nations International Children's Emergency Fund, and 31st October every year is considered to be as a UNICEF Day. Okay, 31st October is considered to be as the UNICEF Day. And the final option was regarding the WHO, and this is the WHO logo, and the WHO Day is considered to be on April 7th every year. Okay, April 7th is considered to be the WHO day, and this is the logo of World Health Organization. Okay, so I think from this question you are getting information regarding 4 important symbols or logos and the four important dates. Okay, so I think that also is useful for you. Now we will move on to the very last question in our series, and this is from the Foundations of Nursing and regarding the therapeutic nurse-patient relationship. And the question is, developing a mutually acceptable contract happens in which phase of therapeutic nurse-patient relationship? So the question is, a mutually acceptable contract happens in which phase of therapeutic nurse-patient relationship? So we know the phases of a therapeutic nurse-patient relationship. So each phase, some peculiarities are there that you should understand. So the options for you are option number A, pre-interaction phase, option number B, orientation phase, option number C, working phase, and option number D, termination phase. So in which phase a mutually acceptable contract happening between the patient and the client, between the nurse and the patient? So what is the answer? So the answer is option number B, that is it is happening in the orientation phase. So we will move on to the explanation which all are the phases of therapeutic nurse-patient relationship, and the key point, only the key point for exam point of view. Okay, so in the pre-interaction phase, what is happening is the nurse will develop a self-awareness. Okay, so the nurse should be aware about what she is going to do. So okay, what is the condition of the patient, so what is the patient, those things will be identified by the nurse during the pre-interaction. So the key term is developing self-awareness. Okay, so the next one is the orientation. Okay, so in the orientation phase, that was the question asked, that the nurse used to develop a mutually acceptable contract with the client. Okay, so that is the orientation phase. And next one is the working phase. So in the working phase, the identification and resolution of the problems are happening during the working phase, and the final phase is the termination phase, where the review and the transfer is happening. Okay, so the review of the relationship and transfer of the patient, and the transfer is happening. Transfer means what all positive things what we can give to the patient at the time of discharge, or when the patient is going away from us, what all good things can be educated to the patients. All these things are happening in the termination phase. Okay, so that is the last phase. So we are giving some takeaways to the patient when they are going home or when they are leaving us. Okay, so that is happening in the termination, that is review and transfer. So these are some key points in the therapeutic nurse-patient relationship. Okay, so from any of these areas you can expect the question, like review and a transfer is happening in which phase, like that also question can come. Okay, so this question also, I think it was very useful for you. So with that, we are coming to the end of this session, and these 15 questions, I know this was a little lengthy, but from 15 questions you are getting a bunch of information. So definitely these questions definitely will help you in preparing well for your upcoming AIIMS NORCET and the JIPMER examination. So once again, thanking you all for watching the video till the end. So kindly share about this platform to your nursing friends, and kindly make use of it, and see you soon in another video very shortly. So till that time, signing out. Thank you once again. Thank you.